Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, today we are discussing one important topics on immunization. Immunization schedule we can see first. At birth, BCG, OPV 0 dose, hepatitis B birth dose. Okay, and at the 6th week, OPV first dose, pentavalent first dose. Pentavalent means include 5 vaccines: diphtheria, pertussis, tetanus, hepatitis B and Hib vaccine. Rotavirus vaccine first dose, FIPV. FIPV means fractional inactivated polio vaccine first dose, and PCV. PCV means pneumococcal conjugated vaccine. This all at 6th week. And at the 10th week, OPV second dose, pentavalent second, rotavirus vaccine second. And at 14th week, OPV third, pentavalent third, rotavirus vaccine third, fractional inactivated polio vaccine second, and PCV second. And at the 9th month, measles or MR vaccine. MR, nowadays MR is giving MR first dose, vitamin A, J means Japanese encephalitis first dose, and PCV booster. And at 16 to 24th month, DPT first booster dose, OPV also booster dose, MR second dose, and J Japanese encephalitis vaccine second dose. And at the age of 5 to 6 years, DPT second booster dose. Okay, and by the age of 10 to 16 years, it is TD. TD means tetanus diphtheria vaccine. Previously it was giving TT. Now it is TD, tetanus diphtheria. Next we can see immunizing agent. Immunizing agents are mainly vaccines, immunoglobulins and antisera. Vaccines include live vaccines, inactivated or killed vaccines, and toxoids. Okay, immunizing agents include vaccines, immunoglobulins and antisera. In that, vaccines include live vaccines, killed vaccines and toxoids. Live vaccines or live attenuated vaccines include bacterial live vaccines and viral live vaccines. Bacterial live vaccines include BCG and typhoid oral. These are bacterial live vaccines. Oral polio vaccine, yellow fever vaccine, measles, rubella, mumps, influenza live vaccine, epidemic typhus vaccine, chickenpox vaccine. These all are viral live vaccines. Bacterial live vaccines and viral live vaccines. Next is killed vaccine or inactivated killed vaccines. It includes bacterial killed and viral killed vaccines. Bacterial killed vaccines include typhoid, cholera, pertussis, meningitis. And viral killed vaccines include rabies, sac polio vaccine, influenza killed vaccine, hepatitis B vaccine, Japanese encephalitis vaccine and DPT vaccine. These are all viral killed vaccines. Next is toxoids. Toxoids include tetanus, diphtheria and botulism. നെക്സ്റ്റ് വന്നിട്ട് റൂട്ട് ഓഫ് അഡ്മിനിസ്ട്രേഷൻ ഓഫ് വാക്സിൻസ്. ഏതൊക്കെ റൂട്ട് വഴിയാണ് ഓരോ വാക്സിൻസും കൊടുക്കുന്നത്? ഓറൽ വാക്സിൻസ്. ഓറൽ വാക്സിൻസ് ഇൻക്ലൂഡ് OPV, വൈറ്റമിൻ എ ആൻഡ് റോട്ടാവൈറസ് വാക്സിൻസ്. ഇൻട്രാഡെർമൽ route BCG. BCG is giving through intradermally. And next is subcutaneous. Through subcutaneous measles or MR vaccine, yellow fever vaccine and Japanese encephalitis vaccine. And intramuscular route TT or TD vaccine, DT, DPT, hepatitis B, IPV, Hib vaccine, PCV and pentavalent vaccine. This all giving through intramuscularly. Okay. Next one important area in the vaccine is cold chain. This cold chain is the system of storage and transport of vaccines at low temperature from the manufacturer to the actual vaccine site. പ്രത്യേക ടെമ്പറേച്ചറിൽ വാക്സിൻ സ്റ്റോർ ചെയ്യുകയും ട്രാൻസ്പോർട്ട് ചെയ്യുകയും ചെയ്യുന്നത് കോൾഡ് ചെയിനിലൂടെയാണ്. ഇതിനകത്ത് മോസ്റ്റ് ഹീറ്റ് സെൻസിറ്റീവ് വാക്സിൻ ഈസ് പോളിയോ വാക്സിൻ ആൻഡ് ഇറ്റ് ഈസ് സ്റ്റോർഡ് അറ്റ് -20°C. ദിസ് ഈസ് വൺ ഓഫ് ദി ഇമ്പോർട്ടൻറ്റ് പോയിന്റ്. ആൻഡ് വാക്സിൻ മസ്റ്റ് ബി സ്റ്റോർഡ് ഇൻ ഫ്രീസർ കമ്പാർട്ട്മെൻറ്റിൽ വെക്കുന്ന വാക്സിൻസ് പോളിയോ ആൻഡ് മീസിൽസ് വാക്സിൻ. Next one important point, vaccines which must be stored in the cold part of refrigerator. That include typhoid, DPT, tetanus, toxoid, DT, BCG and diluent. These vaccines are keeping in the cold part of refrigerator and never allowed to freeze. Okay. And next one important area is cold chain equipment. Frequently questions are coming from this area. Cold chain equipments, first one is walk-in cold room, WIC, walk-in cold room. It is located at regional level and vaccines can stored up to 3 months in walk-in cold room. Next area എന്ന് പറയുന്നത് deep freezers and island refrigerator ആണ്. ഇത് വന്നിട്ട് this is for all district and walk-in cold room locations, mainly to store vaccines. Okay, deep freezers and island refrigerator for all district and walk-in cold room locations. Next area is small deep freezers and island refrigerator. ഇത് വന്നിട്ട് for all PHC, urban family planning centers and postpartum centers. Important point, all vaccines at PHC are stored in island refrigerator. And next area is cold boxes. Cold boxes are supplied to all peripheral centers. Next equipment area is vaccine carrier. It is used to carry small quantities of vaccine, that is 16 to 20 vials of vaccines we can carry in the vaccine carrier, and also it contains 4 fully frozen ice pack. Okay, in the ice pack vaccines are carried with the help of this ice pack. But one important point, DPT vaccine, DT vaccine and TT vaccines and diluent are not directly keeping in the ice pack. Okay. And next equipment area is day carrier. This is also used to carry small quantities of vaccine, that is 6 to 8 vials we can carry in the day carrier, and also it contains 2 fully frozen ice pack. And this we can carry only for few hours because it's contained 2 fully frozen ice pack. So within a limited period only we can use this day carrier. And the next equipment box is ice pack. It contains water and no salt should be added to it. Important points, most heat sensitive vaccine is OPV and most heat resistant vaccine is TT. Maximum efficiency vaccine is measles and lifelong immunity vaccine is mumps. Heat sensitive vaccine OPV, resistant vaccine is TT. Maximum efficiency vaccine measles, lifelong immunity vaccine mumps. Pulse polio immunization program launched in 1995. Universal immunization program launched in 1985. Influenza vaccine was approved in the year 2009. Influenza vaccine. Global immunization program was launched in the year 1974 May. Expanded program on immunization was launched in India in the year 1978 January. Global eradication of smallpox in the year 1980 May. Next important point, Mission Indradhanush. Mission Indradhanush in the year 2014, that is 25 December 2014. It is mainly indicate for 7 killer diseases. The vaccine is mainly for measles, diphtheria, pertussis, tetanus, polio, TB and hepatitis B in Mission Indradhanush. 7 killer diseases. And National Immunization Day is Wednesday. In a refrigerator, BCG is stored at 2 to 8 degrees Celsius. Another important area is milestone in vaccination. This is also one of the important areas. Smallpox vaccine in the year 1798. Rabies vaccine in the year 1885. Cholera vaccine in the year 1892. Toxin or antitoxin immunization against diphtheria is 19 1913. BCG vaccine in the year 1921. Diphtheria toxoid in the year 1923. Pertussis vaccine developed in the year 1923. Tetanus toxoid in the year 1927. Influenza vaccine in the year 1937. And yellow fever vaccine in the year 1937. Mumps vaccine developed in the year 1949. Sachs polio vaccine developed in the year 1954. Sabin live oral polio vaccine developed in the year 1957. Measles vaccine developed in the year 1960. Rubella vaccine in the year 1962. Type C meningococcus vaccine in the year 1968. Type A meningococcus vaccine developed in the year 1971. Hepatitis B vaccine developed in the year 1976. These are milestones in vaccination.